Thank you very much. I'm presenting
Thank you, Stephen.
topic evaluating as to Malaria Rapid Diagnostic Test kit and Artemisinin-based Combination Therapy (ACT) and the quality of treatment practice among over-the-counter medicine sellers in Sene and Atebubu-Amantin district, Brong Ahafo region, Ghana. I'm Stephen. I move straight to my presentation outline. I'm presenting on the background, the problem statement and justification, study objectives and method, results, discussion, study limitation, conclusion, and recommendation. Okay, in Ghana, OTC medicine sellers are the principal source of medicinal products for the Ghanaian rural population. It is estimated that there are over 13,000 OTC medicine sellers in Ghana. And an OTC medicine seller is a licensed private provider who has been authorized to engage in the retail of only over-the-counter drugs, that's class C drugs like anti-malaria drugs, painkillers, dewormers, and cough syrups. And this license is given by the Pharmacy Council, the regulatory authority. This is a picture of an OTC shop in Ghana. The private medicine retailer in fight against malaria. WHO, according to the Rollback Malaria Initiative, include early and effective treatment, specifically at the community level. And most of these private medicine sellers are located in the community level. This means in Sub-Saharan Africa, a lot of people access treatment from these private providers. Malaria Diagnostic, Test, Track, and Test, Treat, and Track. The WHO, the World Health Organization, also recommend test, track, and treat to improve quality of care surveillance. A lot of these chemical sellers and pharmacists treat all fever as malaria, but research shows that there are lots of mistreatment when test is done. So WHO recommend this to prevent expensive anti-malaria waste on patients. This current parasitological testing of all malaria cases under all settings with RDT, especially in settings where resources are constrained, where there is no microscope. And RDT is a diagnostic tool which works on the principle of antigen-antibody reaction. So the tool uses antibody to detect malaria sample. This is a sample of an RDT. This one is a sample test. The two lines are showing positive, one line showing negative. This is one brand commonly used. Access to RDT among medicine sellers in Ghana. All medicine sellers in the district have been trained in the use of malaria RDT. Most of trained ones do not also have it. Most reasons are attributed to this lack of constant or reliable suppliers of the RDT kit, low patronage by clients, and relatively high cost. Then this means there's a challenge. Then they need to build capacity of all chemical sellers to be able to use RDT and also to provide it at the affordable level for all customers. Access to malaria treatment. In rural communities, most people access treatment from their closest, and that is they operate for a longer hours and they charge no consultation fee. There's also relative relationship. Payment is also flexible. A customer can even buy a drug on credit, but a customer will not go to hospital and pay for services on credit. So that is why most clients access the over-the-counter medicine sellers. The WHO also recommend the treatment of uncomplicated malaria with these artemisinin-based combination therapies. The common ones are in Ghana are the artemisinin-Atebubu-Amantin, artemether-lumefantrine, and then hydroartemisinin piperaquine. Aside this, OTC medicine sell other malaria drugs like sulfadoxine, pyrimethamine, SP, quinine, monotherapies, and herbal preparation. This means there's non-compliance here because WHO recommend the use of ACTs to treat uncomplicated malaria, but chemical sellers are selling other non-recommended ones. And reasons are lack of reliable suppliers, inadequate access to the affordable ACTs, and then some of the OTC medicine sellers are not trained, so they don't do proper diagnosis and treatment. This is a photo of samples of ACTs common in Ghana. Problem justification. For the above problem, there's a challenge to access to malaria diagnostic test kit, affordability of the test kit, and also the quality of treatment is questionable. And reference shows that little research has been done in Ghana to indicate the effects of these OTC medicine sellers in malaria control in Ghana. So our research envisaged to benefit the district level, the pharmacy council level, the public health research, and community in the whole, because the findings can be used in restructuring policies when it comes to access to malaria logistics. Our objectives are to evaluate the availability and the source of malaria RDT and the RDT and the ACTs and the quality of treatment among the medicine sellers in the said district in Ghana. We use a cross-descriptive study in the district. This is the district profile. It's one of the most endemic malaria districts in Ghana with a prevalence of 70 to 90, and there are over 100 of the chemical sellers. We randomly selected 62 of the chemical sellers or the OTC medicine sellers, and then we used the balloting system where papers were written of their names, and then we picked randomly. The informed consent was given. The non-legibility criteria is any chemical seller or drug seller who is not in the district, any operator who is also not operating in the district, and then anyone who is below 18 years. This research was conducted in March 5 to 12, 2016. Ethical clearance were obtained from the Kwame Nkrumah University of Science and Technology. Results. Our research shows that 80% of the clients were male, and most of them were between the age of 20 to 59. Like over 90% of them were between 20 to 59. Then over 60 of them have been in malaria training within the past 2 years. Malaria Diagnostic Practice and access to RDT. Our research also revealed that over 54% of the respondents use clinical symptoms to diagnose malaria. They check, well, are you having headache? Are you having bitter taste, fever? And then are you urinating in the Coca-Cola form, or are you having chills? This is how they diagnose it. Only 26.2 use the RDT as recommended by WHO to test for malaria. And then 16 use presumptive. They assume to treat malaria. They treat all fevers as malaria, which is not the case. Okay. And then we also went on to do analysis on the prices of the RDTs. The average wholesale price per set of the RDT was $0.37. That is 1.45 CD equivalent. And the retail price is 2 CDs. That is $0.53. And this is within the recommended rate. National Malaria Control as shown. As it was said in the background, we also found out that the chemical sellers or the OTC sellers don't sell only ACTs. They sell other malaria drugs like quinine, monotherapies like only artemisinin, amodiaquine, SPs, and herbal preparations. This means the availability of an ACT in a shop does not guarantee that it will be sold for the treatment of malaria. It depends on the financial status and the request from the customer. Also, we saw that most of the medicine sellers were not treating malaria in the right dosing formula. According to the treatment protocol, treatment should be based on the weight of the and then the age. We found that most of them, about 69%, were treating based on the age of the client. And then only 4.8 were treating based on the weight. Availability at the chemical seller shops. The most available was AL, that's Artemisinin-based, followed by ASAQ and then AL. The least available was DP. That is attributed to the cost. And this graph also shows, okay, as indicated, over 90% of the respondents offer ACT for treatment. That is from the respondent. And also for the formula they normally give to the client is 4 tablets twice daily for 3 days. They indicate this for both kids and then adults. But for AL should be taken, first dose should be 8 hours. It was only 4 out of the 62 respondents who stated ACT AL should be taken for, the first dose should be taken for 8 hours. Okay, then we move on to the most recommended ACT to clients. We found that AL was the most recommended.
Mr. Stephen, you have 3 more minutes to conclude.
Thank you very much.
Carry on.
So AL was the most prescribed. Over 80% or 85% of the ACT were from outside the district. It was from the second largest city, Kumasi, which is about 5 hours drive from the district. This shows there is a cost because travel costs, and most of them also buy from second line buyers. I will move on to conclusion because I've been discussing alongside the results. So in conclusion, move on to study limits. The study could not interview clients or patients to confirm some of the responses from the OTC medicine sellers. The study also could not ascertain the quality of ACT stocked by the chemical sellers in their shops. In conclusion, you can conclude that majority of the OTC medicine sellers do not comply with the WHO and the National Anti-Malaria Drug Policy. And then only less than 30% of them use RBT to confirm malaria. The study also revealed over 90 of them had in stock RDAs, but all of them dispensed it because there were also non-recommended malaria drugs like quinine, SPs, about 26 to 43.5% were there. In recommendation, there's the need for regular and quality treatment. Easy access to affordable RDT and ACT will improve malaria control at the community level if you want to fight resistance. And there's also a need for strong pharmacovigilance system and regular monitoring at the ACT, the OTC medicine sellers by the Pharmacy Council. These are my references. Thank you very much for the time.